here in Nigeria, it's been the end of another long day, hasn't even ended yet. We continue to respond to this pandemic, the first pandemic, real big pandemic of our lifetime, something we've never faced before, and up to recently appeared to be a hypothetical situation, but right now we're in the middle of it. We've seen waves of this outbreak go through China, Asia. We've seen a big second wave go through a lot of Western Europe and the US. And now we appear to be at the beginning of the third wave in Nigeria, across Africa. We hope that things won't get as bad as we've seen in certain parts of Western Europe. But here we are preparing for the worst while hoping for the best. And actually working hard to prevent the worst happening. So what have we been doing? Unlike in any other disease that we face, our testing strategy is key to everything we do. It's how we determine how many patients that we have. It's how we understand the burden of disease. It's how we understand the opportunity of transmission of this new virus from one person to another. So in order to define the rest of the response, understand where we are, where we're going, understand how many patients will need care, how many patients we will have to provide respiratory support for. All aspects of this response, the number of infection, personal protective equipment we've got to buy, how much people we're reaching with our communication messages. Almost every aspect of this response depends on testing. Now, it's not surprising for anyone that really understands the context that we've had to work in, that we were challenged with our testing capacities in the beginning. The truth is, 4 years ago, there was probably just one molecular lab in Nigeria. But because we've faced quite a number of significant outbreaks, we've spent the last few years building up our molecular diagnostic capacity in Nigeria. Now, PCR testing is a very complicated test. People think about tests in terms of a simple test, like a pregnancy test or HIV test, something that you put a stick into, it gives you a yes or no answer, black or white or something like that. But testing for this new virus is fairly complicated. It's something called real-time PCR testing. Many of the labs across the world that were able to build this capacity much more quickly already had the platform rolled out across the country. We were really at the beginning of this rollout. So when we were hit with this outbreak, of course we quickly built the capacity, got the primers through many of our partners to start testing in Nigeria. What we were not able to do is scale. And the simple reason for this is scaling depended critically on having a network of labs that already had this capacity, were maybe doing it for other infections and only had to switch to COVID-19. Unfortunately, that's not the situation we had. We had a few labs, yes, and those labs became the basis on which we built, but we really did not have the luxury of having a network of labs across the country that already did real-time PCR on a day-to-day basis. So we've been building from the ground up. Now, despite a lot of the criticisms and the challenges, we put our heads down and we have been working, every single day of the week, the last 2 months. Colleagues have been working in Lagos, Abuja, and across our network to build up our lab testing capacity. So we had 4 approaches to this. Firstly, is to re-engineer our molecular basic lab capacity. So how do we re-engineer the processes in the labs that we had to do more? So we moved to a shift system. So at the National Reference Lab at the moment, we run 3 shifts. So we had to organize in the context of no movement, the vehicles for people to get to work, the payment structures, the organizational changes that we had to make to move from a normal 9 to 5 or 8 to 4 working day to a 24-hour working pattern every single day of the week. Had to be sure that we had the facilities to do this, the electricity, the internet, and everything that goes with providing a 24-hour service. It's not something you can simply switch on or off. Make sure the supply chain is working, and all of that. So that's the first part. And out of that, we've increased our daily capacity at the moment from 5,000 samples a day to 1,500, and we're looking to hit 2,000 this week. The other thing was, in addition to just increasing the numbers of tests that we can do, we also recognized that it was important to redistribute our lab network and to make sure that we had labs across at least 4 to 5 hours vehicular access to the lab across the country. So we went on an aggressive expansion process. Now, realizing that it's the same people, the same scarce people that were building up our lab testing capacity, that also we also needed to activate these labs across the country. So, very tricky situation. Do I keep them here in Abuja and increase the testing capacity in Abuja, or do I send them out to Kano, Kaduna, Jos, Maiduguri to roll out new labs? So eventually we found a compromise. We moved from 1 team to 2 teams, and that is really how we've been able to activate 7 new labs in the last 10 days. We have a few more on our horizons, Gombe, Sokoto, then we'll go to Ogun. So Ogun State, so there are lots of labs in the process, and we're looking to activate this while increasing the throughput in our existing labs. But really that's only the beginning. From this, there are 2 big game changers. This is using some equipment that we have from our HIV programming to do to scale our capacity. Now, this is equipment that we had that does high throughput testing for HIV. The limitation here is not the equipment. We have these big machines in 6 cities across the country. The limitation has been the access to the reagents. And there are sometimes that the problems that even money and energy and emotion cannot solve for you. We had to get these reagents into the country. We've just gotten our first supply, has just arrived in Nigeria, and we will be able, over the next 2 days, once we do some alignment and calibration, make sure that we're able to roll out high throughput testing. So these machines can do up to 3,000 tests per day in a single machine, and we have about 7 of them that we can scale to gradually as we increase our testing capacity. The third approach is to reconfigure a set of equipments that were basically working for the TB program. They're called Gene Expert machines. Now, these don't have the capacity to do high throughput testing, but they're easy machines. So we will use that to achieve more geographical distribution of our existing machines, and through that we will really take testing for COVID-19 much closer to the people. And that will, again, help us in spread. So you have noticed in my narrative, we have 2 strategies. 1 is to increase throughput in those areas of high incidence, and 2 is to increase access across the country, geographical access to the testing. The 4th part of our strategy is to include the private sector. Now, private sector has historically not been very interested in diagnosis of infectious diseases, but because basically they didn't see that to be a profitable area of work. So very little investment, very little development had gone into private sector testing for infectious diseases. And this is a fact that many people in the private sector will not admit to. But this is the reality. There was simply not sufficient thinking around how do I provide the biosafety environment in my lab to do the testing that we need to do for viruses and bacteria. Now they're coming to the table, and there have been some very exciting efforts in Lagos with a great group called 54 Gene that are developing a whole new approach to provide private sector testing, and we've been working with them to make sure they have the right standards, the right quality assurance, the right processes to go into testing for COVID, as well as potentially other infectious diseases. We've just signed up our first private lab in Kaduna. It's called DNA Labs, and they're the first private lab to fully join our network. We accredited them, did the quality assurance, they're good to go, they're part of the network, and we're excited to have them aboard. So as we're doing all of this, I've explained 4 parts of our expansion processes. I think the final part, really the most exciting part of this, is as we're looking to solve the short-term issue around testing, we're also very aware that we don't want to be in a similar situation in a few years' time. So we have an infrastructure project going on now to build new labs in certain states. We hope to get a molecular lab in every state in Nigeria. We may not be able to get there immediately, so we'll have to prioritize. Some of this is from NCDC, some are by state governments, some is by the private sector, some is a public-private collaboration. But whatever model, it really doesn't matter. We know, we've learned that, you know, even if not all aspects of our work is immediately focusing on a profit margin, we have to provide the health security in order to continue our lives and our efforts. And the private sector, corporate Nigeria, has come to the hard realization that a single outbreak can stop the entire economy. So we all have to contribute to these efforts, that we need to pool our resources and make sure that we have the labs that will enable us to build up on our health security. So really, I wanted to spend a few minutes this evening describing to Nigerians the very hard work going on. There's a huge team working on this, thinking about solutions. I'll be the first to hold up my hands and say, listen, we had some difficulties in the beginning of this process. Over the next few days, you will see the testing numbers rise exponentially. The bottleneck, even now as we speak, this evening, is not about the testing capacity in the labs. It's the efficiency of collecting the right samples from the right patients and bringing it to the lab, distributing it to the labs. The labs across the network are ready to test. They're working 24 hours in many settings, and we're good to go. We may not have been the fastest off the starting blocks, but you know, we have built a system that we can scale. And over the next few weeks, we will scale. We will build a uniquely Nigerian solution to a problem that is uniquely Nigerian. We know the context that we are being compared to. We know the advantages that countries like South Africa have in their lab testing network. We know the differences between us and many countries in the West that we've been compared to. But you know, my commitment to Nigeria and to everyone watching this show is, yes, we've had a slow start, but we're off the blocks now, and we're good to go and ready to provide our country, our leadership, and its people the laboratory diagnosis to really understand where we are in this outbreak and make sure that we're prepared for the challenges ahead. So I'll pause here for now. I look forward to your questions. I look forward to having an exciting conversation around the topics around testing that matter to you. So thank you very much. So the first question says, I hear your Gadua office has a capacity for 6,000 through automated equipment, yet NCDC uses manual. This is an odd question. I'm not sure how much you know, the guy asking or lady asking this understands how molecular testing capacity molecular testing works. You know, the first thing I'd love to do is invite you to NRL to be taking around the lab. Of course, we'll do that safely, give you the PPE you need. I'd like to really take you around and walk through the lab for you to see the processes that have to happen when a single sample of any infectious disease comes in. You know, in our national reference lab, we deal with all sorts, with Lassa, monkeypox, influenza, yellow fever. We move from one to the other. So, you know, there's no magic bullet around this. We've had a real-time PCR process, is half automated. We're now moving to a set of equipment that was procured for HIV. This is a new disease. Up to 3 months ago, there was no automated equipment for the disease because the disease did not exist. The innovations in terms of realigning some of the equipment we had for HIV and TB happened in the last few weeks. The supplies that we've gotten the first set of this evening is the first coming to us. I'm not sure any other country in Africa has received them. So we are in the process now of using this huge equipment for HIV to do COVID-19 testing. It's not a shame that we've been doing manual extraction. That's the optimal process. But now we can move into a more automated process. So the honest truth, we are where we are in Nigeria. There's no magic around it. It's the reason we don't have 24 hours power as in other countries. It's the reason not all of our roads are perfect. But we have to tell ourselves the truth. This is where we are, this is where we want to go, and this is what it will take to get from point A to point B. And for the team in NCDC, we're absolutely committed to doing the hard work it needs to take us to where we want to go. So I hope that answers this question. The next one says there are unconfirmed reports that you stated that the virus will spread to every state of the country. Please, can you confirm this? Listen, guys, we're talking about an infectious disease, a virus that spreads from person to person. There's nothing, the states that we have drawn across the country, the lines with which we've divided our country. Do you really think the viruses understand where our political borders are? Hell no, they don't. People travel in Nigeria, even with the lockdown. People are traveling. So if you travel and you're infected, you will take the virus. The virus hasn't jumped from Lagos to Kano by some miracle. It is gone because people have traveled. And now there are a few cases in Kano. We confirmed 12 yesterday. And people will travel from Kano to other parts of the country. So listen, there's no part of the country that think they'll be immune to this. So yes, I did say that we are working on the hypothesis that every single state in Nigeria will be affected by this virus. If we're able to stop that, we will celebrate. But our working hypothesis is that it will spread, and we're working very hard to ensure that every state understands what they need to do to be prepared to prevent, prepared to detect, and prepared to respond. There's no other responsible action I can have. There's no alternative responsible position I can have as the leader of the Nigeria Center for Disease Control than to make sure that every state is aware of the risks that they face and are prepared for this. So let's see what else is coming in. A question says, can NCDC concentrate on areas with possible community spread to ensure that the virus is curbed? This concept of identifying areas has come up a fair bit over the last couple of days. I'm not sure what is driving this conversation. I don't know whether people think that by avoiding certain parts of the town where they think people infected may live, may protect them from getting infected themselves. Really, this is really not how we're thinking about control measures. This is a respiratory virus. It is spread from person to person. Human beings are not static. We move around. The whole idea of the lockdown ordered by Mr. President is to reduce the amount of contact that we have with each other, right? Now, we know that in Nigeria, we're never going to be 100% successful. There are exceptions in terms of when people can go to the market, when they can go and buy food. So these exceptions make it possible that people congregate in one place. The most likely point of infection is not necessarily where you live, because most people are home where you live. The most likely point of infection is where we come in contact with each other. So public spaces, wherever people congregate, wherever there's a lot of contact with surfaces, because this virus does survive on surfaces for a few hours. So the whole concept of identifying, we know where people live. We don't think it's necessary to share. We think it will stigmatize people living in a specific area. It's not our role to do so. We're working very hard to make sure we give people the right messages for the right preventive action. And we hope that, the more we learn about this virus, the more we're able to inform Nigerians on the right things to do and enable us the capacity to prevent transmission where it's possible, and where it's not possible, bring people into care as quickly as we can. Have some water, please. So there's another question that says the new cases in Lagos. Can you confirm that there is community spread, and is it not necessary to mention areas so people in such areas can forcefully react? I think we've already answered this. Yes, there are some early indications of community transmission. We saw this a few weeks ago when we started seeing patients or cases that either did not have a travel history or did not have any obvious contact with a confirmed case. So this is really what has led us to change our strategy a little bit. So in Lagos, we have now set up in 20 local governments, specific locations where people feeling ill can go and get a sample collected. This is in addition, it's not in place of the mechanism through which you can call up and request a sample to be collected that you're not feeling, if you're not feeling well. We've, in addition to that, set up this centers in a few local governments. In addition to that, we also have teams that are going from hospital to hospital in Lagos, identifying people that may have an acute respiratory infection with a fever, taking samples from them just to be sure that we're not missing out on any possible case. So we're really adjusting our strategy as we progress. That's the beauty of epidemiology, the ability to use data very quickly, collect data, analyze it, use it to shape your response, change your response as you need to. In Abuja, a similar strategy, only in this case, we're actually going right into the community in some places, looking for people that might have this infection, taking samples from them, testing them, and we've had a few positives from this approach. So there's no right path when you have a new disease. You have to think aggressively, implement what you're thinking, see whether it's yielding results, change strategy as you move along. And that's the beauty of field epidemiology. So let's see. The next one says, do you have an independent laboratory for EQA for all the serving labs? Yes, that's the role the National Reference Lab in Abuja, in Gadua, plays for the network, the labs in the network. In fact, almost everything we do for COVID-19 is actually run centrally. So we procure all the reagents here, not just the reagents, the sample collection kits, the swabs, something we call virus transport media, because this virus cannot survive for long hours. To transport it from one state to another, you have to, you have to put it in a specific media to transport it to the lab. So what we're doing is importing all of that. Very little of it is produced in Nigeria. So we're procuring centrally. We also get a donation from our partners. The UN just sent us a big consignment. You would have seen reports from all the other donations that we've received. We then do an assessment of which lab needs what, at what point. So a significantly complex logistical exercise. We get reports from them every day on their stock, on what they've used up, of what their remaining stock is. Based on that, we resupply each of the labs. Now, it's complex because there's literally no commercial transportation across Nigeria right now, so we have to distribute a lot of this with our own vehicles and make sure that we provide them enough to do what they need to do within the space that they have to do it. So not an easy process at all, both in terms of the quality assurance, in terms of the redistribution of commodities, but we're pushing very hard. We have hardly had any stockouts in any of our labs up till date, and we hope to keep that up as we develop this network to serve the entire country. It's a big and complex country. The labs down in the south, up in the north now, from Maiduguri to Irua, from Lagos to Kano and Kaduna. So, labs across the country, and we're making sure we try very hard to keep the supply chain flowing, keep the quality assurance high, and make sure whenever we tell someone he's got a positive result, he actually does have a positive result. And when we say you have a negative result, we're actually sure that that individual is negative. So one starts with, well done, sir. I like that. Then it says, Lagos State has been on lockdown, but still recording new cases. What effort has been made, sir? Thank you very much. Lockdowns are never perfect. So we have to use the next best thing. We never anticipated that we will stop transmission completely with a lockdown, because people live from day to day in our societies. People have to go out. There were exceptions made for people to go and buy food and do some essentials. So we never expected to have a complete lockdown. But all the data that we have, we analyze all sorts of data sources. one of the most exciting data sources is something called the Google Mobility Index that we use to look at how much people congregate in specific locations. And we've seen reductions of 50, 60, 70% in some instances of congregation in certain specific locations across the city. So yes, we haven't seen a complete cessation of transmission, but we do think that we've seen an impact on transmission, and hope that that will ultimately lead us to bending the curve downwards, which is what we're trying to do. But there's no way we can have an immediate impact on any of the measures that we've instituted. So another question says, are you working with the international bodies on ways to accelerate vaccine development for the virus? Firstly, to say that there's no disease that I remember that has brought as much collaboration between countries like this new disease. You know, we were all at the same point 3.5, 4 months ago. You know, this is a new virus. No one knew anything about the virus. The first thing we did when we had our first case in Nigeria was sequence the virus. We were the first country in Africa that had sequenced its own virus. That sequencing was done here on the continent by two groups, the Nigerian Institute for Medical Research in Lagos and the Redeemers University in Ede. They did that in parallel. Both of them produced the results at the same time and reported it. So extremely proud of the research done by those groups. You know, vaccine development itself is a very complex thing to do. We're working on restarting vaccine development for some of our older diseases, yellow fever specifically. There's a public-private partnership working right now to do so. But to start vaccine development for a completely new disease at this time is just one step too far for us right now. So what we're doing is working with the international groups, making sure that the data we are producing, the epidemiological data, the virological data, feeds into the vaccine development, so that when that vaccine is developed, we're sure that it will also be effective for the strain of virus circulating in Nigeria. So a few more questions. One is, what is the plan for testing airplane passengers once the airspace reopens? Now, those plans are currently being made. It is likely that if you have to travel right now, on return to Nigeria, you will probably have to be quarantined for some time. There are discussions going on where that quarantine will be, whether you'll be allowed to stay at home or whether you'll be quarantined in a specific location for 14 days. So not an easy decision, but these are decisions that we will have to make as we reopen the airspace. Now, this is a question many other countries in the world are grappling with. You know, there are hard discussions, and the whole question on when to reopen, how to do that. What do you reopen first? What do you activate first? We're not the only ones grappling with that question. Almost every country in the world is faced with this same set of questions. And sometimes when you've seen extensions of lockdowns, it's because no one quite knows how to open up. So we will eventually have to relax the lockdown. I don't think international flights will be the first thing to happen. It will be a calibrated release. But ultimately, the decision on when to reopen the country is Mr. President's exclusive decision to take. Our role is to advise him, and he ultimately has the responsibility of deciding on when the lockdown should be relaxed. There's a question on what about the doctors on the front line? Is any PPE available for them? What we have ensured at the moment is that every state in Nigeria received a starter pack in order to be sure that they have the basics that they need to respond to a new case. Every FMC, every teaching hospital in the country also received something just to be sure that they have enough to respond in the first place. In addition, any center that has gone on to confirm cases, we have made sure that we have provided them with the PPE supplies that they have needed to treat and manage these cases. There have been no reports of stockouts in any of our treatment centers so far. We have sufficient PPEs in the stockpiles right now to continue supporting. Many states have procured PPEs themselves, and that's an excellent that they're doing so. The private sector has also come forward to supply, procure, and deliver a lot of PPEs. So one of the hardest things we've learned how to do is to manage a very complex supply chain. We've developed some software for that, which we're now implementing. And this is really how we've managed the demand and supply of this. So excellent arrangements, but yes, always fragile because a lot of these things are not produced in Nigeria. We depend on a supply chain coming from outside the country, and that obviously is not completely in our hands. So if there's one good thing that will come out of this outbreak, is for Nigerian industries to step up to the challenge, to develop the capacity to produce some of the personal protective equipment that we need, whether they're gowns, masks, boots, lots of them. I don't think, in my estimation, that the need for this will disappear in a hurry. Probably never. So if you're thinking of a business to start right now, the production of personal protective equipment is probably a good idea. So how many tests have we done so far? I promised in the press briefing this morning to release the number of tests that we've done every Friday at 6 p.m. every week. And that's a commitment that we're sharing with Nigerians through this platform as well. At the moment, we've done about 7,000 tests thereabouts. Those numbers are not precise because we're still collating, but we're focused on at 6 p.m. On Friday, and making sure at 6 p.m. every Friday we're able to release this data to Nigerians. One thing that you will see day to day is an increasing number of tests as we implement our new testing strategy across the country. So we will see a lot more tests done over the next few weeks, and as we increase and introduce the new testing technologies that we've implemented, I referred to them earlier, we'll find a lot more tests happening, especially in areas of highest burden, Lagos, Abuja, increasingly Kano. So I think to conclude, really to thank everyone that has joined this session today. I hope I have answered most of your questions satisfactorily. We at NCDC, we're really grateful for the level of engagement that we've had. Everyone listening knows that this is a new virus. We're a small, young agency. We've gotten a lot of support from the Presidential Task Force, from the rest of government to build on the work that we've started. It's not been an easy journey, but no one has slept well in this organization for the past 3 to 4 months. We remain committed to serving Nigerians. We remain committed to ensuring that we have a good story to tell out of this. We're by no means out of the woods. We don't know where we are on the curve. There's no indication that we are anywhere close to the peak. So that's the scenario that informs our work at the moment. So as we go to bed every night, we know we have to get up the next morning and start exactly where we stopped. So if there have been any inadequacies in our deliveries as expected across the world, especially by Nigerians, we do hold up our hands and say we're sorry, but we're going to keep pushing to make sure that we have a continuous improvement in the quality, in the distribution of our testing capacity specifically, and make sure that we are able to provide a test for every Nigerian that needs it, detect the disease, make sure we bring people into care as quickly as possible, and look forward to ending this outbreak. Every outbreak does come to an end eventually, and this one too will end. We need your support, and we know you'll work side by side with us as we fight this outbreak across the country.